nivel 2.
I'm making another phone call to a psychiatrist. I'm needing to get to a doctor.
Please listen carefully as our phone prompts have changed.
Look how they prevent
For
me from
general
using the phone.
information or questions regarding COVID or the COVID vaccine, please press 1. If you received a communication from Denver Health to schedule your COVID vaccine, please press 2. To hear these options again, please press star. Otherwise, remain on the line for non-COVID vaccine-related appointments.
If this is an emergency, please hang up and dial 911. Please listen carefully.
Look, I don't even want to use my phone because the speaker, the sound of what this sounds, they're not letting me use my own phone.
For Medicaid or
it's a way to restrict the ability for me to be able to take care or do what I need to do for myself in any comfortable way.
If you are a Denver Health staff member, press 6.
Now they're shooting some electronic device at me. It's making me feel like I gotta cry.
A representative will be with you shortly.
I can feel right now it's a machine that they're shooting at me right now.
If this is an emergency, please hang up and dial 911. Please listen carefully as our options have recently changed. To make or change an
appointment, look at this shit.
Please press 1. To cancel an appointment, press 2.
Okay, so I'm gonna call Social Security in Dallas, and then I'm so fucking irritated right now. And they just play games. This is what they do to me all the time on my phone. I'm on my phone right now. This is what they do all day. They just sit around, and this is what they do.
Thank you for calling the Dallas North Social Security Office.
Look, they're doing it again.
The Social Security Administration is taking steps to protect the public and our employees during the coronavirus or COVID-19 pandemic. Until further notice, offices are open to provide limited, dire need in-person services by appointment only. We will continue offering services by phone and online. Please stay on the line for an agent, or visit us online at www.ssa.gov/online services. If you have any questions regarding economic impact payments, please contact IRS at www.irs.gov/coronavirus. For information about fraud,
press or say 1. To continue with your call, press or say 2. To hear these options again, press or say 9. To ensure that you receive accurate and courteous service, your call may be monitored or recorded. Please listen to all options carefully. Our menu has recently changed. The office is currently closed. Office hours are from 9 a.m. to 4 p.m. Monday through Friday, excluding federal holidays. To hear field office hours and directions, press or say 4. If you are calling to leave a message and know your party's extension, press or say 5. To hear these options again, press or say 9.
Like I don't even want to use my phone.
We did not recognize your selection. To hear field office hours and directions, press or say 4. If you are calling to leave a message and know your party's extension, press or say 5. To hear these options again, press or say 9.
I can't even pay attention.
We did not recognize your selection. To hear field office hours and directions, press or say 4. If you are calling to leave a message and know your party's extension, press or say 5. To hear these options again, the Dallas North Social Security Office is located at 10824 North Central Expressway.
The office is open to the public by appointment only for limited in-person, dire need situations.
On southbound Interstate 75, exit at Royal. Go south on Access Road to Meadow.
Look, I'm calling for the security office, and this is how they're tapping my phone.
We did not recognize your selection. The Dallas North Social Security Office is located at 10824 North Central Expressway.
The office is open to the public by appointment only for limited in-person, dire need situations.
On southbound Interstate 75, exit at Royal. Go south on Access Road to Meadow. Turn left on Meadow and
Look at this
immediately
shit.
turn left on the northbound access road. The office is located next to the Service King collision.
Look, I'll call different numbers. It's insane what these people are doing.
This is Chong. I'm calling from Aurora Mental Health Center. I received your voicemail. So yeah, we can definitely schedule, but I wanted to let you know.
I swear to God, right now they're changing the phones, and you can hear this, like, on how, and it's very frustrating because I'm trying to focus on what I need to do, and they won't let me. They make it so strenuous that I can't do anything pleasant. Nothing. I'll call a different number. They're giving me phone numbers. I'm calling the clinics. The people that are picking up the phone, I have no idea who they are. They cannot even be calling a clinic at all. And they'll give me some phone number to call that is someone who they want me to be harassed by. This is how sophisticated my entire phone calls are being rerouted to whoever they choose for it to go to. They just play games with me over the
Behavioral
phone.
Health Services at Denver Health. If this is a medical emergency, hang up and dial 911. Para Español, oprima el 9. For outpatient behavioral health services, press 1. For adult inpatient, press 2. For child and adolescent services.
You have reached Denver Health Outpatient Behavioral Health Services. If this is a medical emergency, hang up and dial 911. Para Español, oprima el 9. If you're a new patient seeking a mental health appointment, methadone, Suboxone, or drug and alcohol intakes, press 1. For information regarding additional options for mental health, drug and alcohol treatment, or if you're pregnant, have dependent children, or are an injection drug
Look
user,
at this shit.
press 2. If you're an existing patient,
You see that
who needs to make
they're
a
doing all these
appointment,
sounds.
press 3. To reach the urine color line or OBHS emergency. For information regarding the methadone clinic, press 1. For information on Suboxone, press 2. To schedule a mental health appointment for a new adult patient, press 3. Thank you for calling the Adult Mental Health Line. We are currently accepting new patients on a first-come, first-served basis. We provide therapy and medication management to patients who meet eligibility criteria. To qualify for services, you must have a primary care physician, have active insurance,
You see what they're doing
not
to the
be
phone
abusing alcohol
speaker?
or
Like,
other drugs, and have the ability
I'm having
to
the speaker
appointments.
face away from
If
me,
you
and
do
it
not
still
meet these requirements,
hurts my eardrums.
please
It's
refer
not
to
me.
your
They're
insurance
doing
provider
this.
for a list
They
of other
intentionally
services.
make this.
If you have Denver Medicaid and would like to connect to Colorado Access, press 1. If you do meet these requirements, press 2 to leave a message with your name and the best phone number to reach you at. We will return your call as soon as
I can't even
possible.
pay attention.
Thank you.
Do you see what they're trying to do? Have deter
Thank
me
you
from
for
being
calling
able to
the
do what I
Adult
need to
Mental
do?
Health Line. We are currently accepting new patients on a first-come, first-served basis. We provide therapy and medication management to patients who meet eligibility criteria. To qualify for services, you must have a primary care physician, have active insurance, not be abusing alcohol or other drugs,
The
and
more
have the ability
unhealthy I
to
get,
attend
the
appointments.
happier they get.
If you do not meet these requirements, please refer to your insurance provider for a list of other services. If you have Denver Medicaid and would like to connect to Colorado Access, press 1. If you do meet these requirements, press 2 to leave a message with your name. We are currently taking a limited number of new mental health patients. As a result, you can expect a return phone call in a week.
I just need to get my medication. This
Please
isn't a
be
mental
sure
health
to slowly
problem that I
state your
have.
name, insurance
This
provider,
is how they do
the
it.
reason you are calling, and a good number where you can be reached. Please be aware that not all callers will be eligible for an intake appointment. If our timeline does not meet your needs, please feel free to call the Mental Health Center of Denver at 303-504-6500 or your insurance company for more options. If you feel you may meet the criteria for substance abuse treatment, please call our triage nurses at 303-436-5699.
How am I supposed to make doctor's appointments with it?
And need immediate assistance, please hang up and call the Colorado Mental Health Crisis Line at 1-844-493-8255. They are staffed for 24-hour assistance and assessment. Thank you for calling and for having patience while waiting to hear from us. We look forward to speaking with you. Have a great day.
Record your message at the tone. When you are finished, hang up or press pound for more options.
Hello, my name is Emiliano Hector Palomo. You can please call me back at 214-299-2305. My email is housescratch@yahoo.com. And my social is 451-993680. And if you can, my date of birth is 1684. Please call me back at 214-299-2305. I'm calling to make an appointment. I need a refill on the Abilify 20 milligrams. And I'm having a lot of trouble making any kind of appointments in the state of Colorado. Please give me a call as soon as you can. For those that want to know, this is not a mental health meltdown that I'm having. I want to show y'all that the reason I take this medication is because the disability office, besides everything that's going on, it helps secure my my disability payments, because they're always trying to find reasons why not to give me any money. And the worse my life gets, health-wise, mental-wise, the happier they get, the more pleasant they are on the phone, the more joy that I can hear in their voice, the more accepting that they are. The worse that I get, the happier they are. And some of the things that I do, among all the other injuries that I have from my transplant and still having low platelet counts, regardless if I eat healthy or not, is to let them know, because they work in a government system, not compassion. So for those that want to know, like I said, I'm begging to all y'all, please understand that these people are not my friends. These people don't care anything about my life but to make things worse and enjoy the agony that I'm in, trying to take care of myself and not allowing me, making it as uncomfortable and pleasant as they can. And this is what they do every day. Some gay individual males are sitting in their house somewhere, teams of them, relaxed, and they watch me like they watch a TV program, and they have their computer right next to the TV or their room, and they monitor everything that I'm doing, watching me, stalking me, and they just, within a click of a button, they turn on these devices, they track me down, they send people to come pull knives on me. A lot of bad situations that are happening. I've been threatened multiple times that they were going to be coming after my family, dozens of times. So please, for those that want to know, like I said, I'm not joking when they do this to me. I'm not doing anything right now other than make doctor's appointments, even to see if I have cancer again. And this is what they do to me.